Today, the state's health agency announced a child died from the measles in Lubbock.
The outbreak has been largely centered in West Texas counties, but warnings about possible infections stretch down to San Marcos and San Antonio. Joining us now is Dr. Peter Hotez with Baylor College of Medicine. Dr. Hotez, thank you for your time this afternoon. How significant is the current threat of measles, and what's contributing to this resurgence?
Well, it's a pretty big epidemic where we know there's at least 120 plus cases in West Texas. It's also moved into on the border with New Mexico, but it's still accelerating. So measles has an incubation period, meaning from the time you're infected to the time you show symptoms of almost 2 weeks. So we expect those numbers will continue to accelerate. The reason it's happening is because there's so many unvaccinated kids in West Texas. It began in a Mennonite community, which typically does not have any prohibitions against vaccines, but it began there, and now it's continuing to plow through lots of West Texas where vaccination rates are low. Once vaccination rates go down below 90% for the MMR vaccine, the measles, mumps, rubella vaccine, measles has a good way of exploiting that, and that's what's taking off right now.
You said it's accelerating. We've got the rodeo coming up. What are the potential risks of a measles outbreak at large public events like the rodeo, and how can they be mitigated?
Well, although it's starting in West Texas, remember, of course, the rodeo brings in people from all over the state of Texas, so it's reasonable to think that there could be individuals who are shedding measles virus before they start showing the signs and symptoms at the rodeo. And the problem is that measles virus is highly infectious, and it can linger in the atmosphere for sometimes for a couple of hours, even after the person has left the venue. So if you attend the rodeo, and I would encourage all Houstonians to do it, what you need to do is make certain that you're up to date on your measles vaccinations. A single dose of measles vaccine, which you typically get around 1 year of age, is more than 90% protective, and 2 doses is 97% protective. So that measles overwhelmingly is only a severe problem in those who are unvaccinated. So that's what you want to make certain that if you come to the rodeo, and as again, I'm encouraging Houstonians to do that by all means, make certain that you and your family are up to date with your vaccines.
Dr. Hotez, remind us again what those symptoms look like, what they include, and what would you say to parents who are hesitant about vaccinating their kids?
Well, it begins with a constellation of symptoms, what we sometimes call the 3 C's: cough, what's called coryza, which means upper respiratory symptoms, congestion, runny nose, and conjunctivitis, redness in the eyes. And then it proceeds with a characteristic rash that starts around the face and head and neck and then extends all the way down the body, and that's when it is accompanied by high fever. The problem is of the complications. So around 20% of kids who are unvaccinated will require hospitalization, either because of pneumonia that subsequently results, requiring respiratory care, measles diarrhea causing dehydration, measles encephalitis, permanent neurologic injury, deafness. So it's a bad actor. And this is why it's so absolutely critically important that you make certain that your children are vaccinated with measles. And if you have any questions, consult with your pediatrician or pediatric care provider.
Yeah, certainly is a public health concern. Dr. Peter Hotez, Dean for the National School of Tropical Medicine at Baylor College of Medicine. We appreciate your insight and your perspective. Thank you.
Thanks so much.